Another beautiful episode of Healthy Living reaching you from the nation's capital, Abuja. I am Olamide Al-Hassan. Hypertension is a leading risk factor for cardiovascular diseases worldwide. Low and medium income countries, including Nigeria, appear to be worst hit with relatively higher number of cases and limited awareness, treatment and control rates against the trend observed in developed countries. In Nigeria, hypertension is the most frequently diagnosed cardiovascular disease risk equivalent, with hypertension-related complications accounting for approximately a quarter of emergency admissions in urban hospitals. Hence, improved understanding of the current burden of hypertension, including awareness, treatment and control, is needed to guide relevant preventive measures in Nigeria. In the studio today, we have community health worker Happiness Moses to help us shed light on this cardiovascular disease called hypertension and hypotension, with focus on what it is, the risk factors, causes, and preventive measures. But just before we meet her, let's take a few health roundup stories for this week. Stay tuned. Yeah, welcome to the studio once again, Ms. Happiness Moses.
Thank you.
How are you doing today?
I'm doing well.
And we're glad you could make time for us.
Thank you so much for having me.
Thank you too for coming. So because we're discussing hypertension today, I want you to please shed light on what it is, what hypertension really means. It's not like, it sounds like a topic that has been well flogged, but at the same time, I don't think that there's enough awareness for it. So could you please just shed light on what hypertension is, first of all?
Okay. Hypertension, also known as high blood pressure, commonly people call it high blood pressure, is a condition in which the force of blood against the artery is too high, or rather, let's say it is when the pressure in the blood vessels is too high, like the pressure at which the blood is flowing in the vessels is too high. That's what we call hypertension or high blood pressure. So it has a lot of causes, but then we'll get into that.
Okay, because I'm beginning to wonder when the blood pressure is too high, like the blood passage, that's what you mean?
Yes.
So I'm beginning to wonder what could want to make blood, passage become so high? Because I believe that there's supposed to be a very smooth flow to the heart and all, and the heart's supposed to pump the blood at, I don't know what you guys call it, but
yeah,
I'm sure you understand what I'm talking about.
Yeah,
so
I understand.
What now suddenly makes the pressure high? Because I'm trying to picture it like a tap water running.
Yeah.
So what's going to make that high? What could cause that?
Okay, like you said, you're picturing it like a tap water. Tap water should run in a pipe.
Yes.
So these blood vessels are like pipes. So let's take, for example, that we have something in the blood vessels that is not allowing it to flow, or for example, like a tap, like you said. Let's take, for example, that there is something in the tap that is not making it to pass through very well. The rate at which water will be rushing from the tap now will now be very small.
Yes.
Little, because something is obstructing it. So just like that pressure, something must have caused the pressure in the blood vessels to be high. So when something is there that is not allowing it to flow easily, that's what now raises your blood pressure. Some people, maybe like cholesterol, stress, a lot of things can make your blood vessels to become narrow, and then it will not allow the blood flow to be normal.
Okay, so when, for instance, there's an obstruction and the blood flow is not normal, is that what they call the hypotension?
Yes, hypertension. Hypertension.
Okay, I've heard of the lower one too.
Yeah, the lower one is called hypotension.
Yes, that's what I said. Is that what they call hypotension?
No, that is what they call the hypertension.
Okay, no, I mean when the stream is lower, when you have a lower pressure.
Yeah, different things causes a lower blood pressure. Different things. It has its own different cause.
Oh, so it's like a totally different
it's a totally different case. When it is high, is a different case. When it is low, is a different case. They are not together.
Okay.
So even though we say that one is even more dangerous than being high, because when it is high, it's easier to give you something to bring it back to normal.
I think we must definitely talk about both of them, but let's focus first of all on hyper.
Right.
So what are the risk factors associated with this cardiovascular disease?
Well, hypertension has a lot of risk factors, and that's why people come up with it suddenly. They say, we suddenly BP, you know, our average people will say BP, 9 BP, kill 'em, just like that. You understand?
We hear that often.
So all the time, but it's not something that starts just like that. It's a lifestyle. So one of the risk factors is your lifestyle, your choice of living. It makes a lot of impact on whether your your pressure will rise or not. So one of the risk factors, look at age.
Okay.
So talking about age, you know, most times, just like I said, life choices. You notice that this hypertension is mostly found in people who are ranging from 40, 50, 60, 70. But then this must have been because of the life choices they have made.
In their earlier years.
In their earlier years. Okay. So these are the things. This is one of the risk factors. Of course, we have genetics too. The reason why genetics find itself there is that when people grow in a certain area, there is chances that they will live the same kind of life.
Okay.
Yes. For example, growing up in a place whereby drinking too much alcohol is a norm. So there is every tendencies that you will move from that. You will still live that kind of life. So that's where genetics come in.
Okay.
Also, overweight. Most people who are obese or has much weight, you know, they are at risk because they have kind of, the weight they have now is more than what the heart is working. It's as if the heart cannot carry it anymore.
But sorry to cut you there. I'm surprised that our weight sometimes will affect our health.
Yeah.
Especially this, you're talking about the weight can affect it in the sense that the heart may not be able to pump the blood anymore. But I'm wondering, I thought that by our body, you know, the same way we increase in our body, every other organs in our body are supposed to increase to balance up. Because most people always laugh and say, as I'm growing, my tummy too keeps growing. You know, if every other aspect of your body can grow, so why shouldn't those your internal organs that are functioning grow and make room for all of these things?
Well, it might surprise you to know that the internal organs are all of an adult generally are having the same size.
Everybody?
Yeah, the internal organs like liver, like heart, like bladder, kidneys.
Really?
They don't really have a different size ranging from one person to the other.
No wonder people can donate kidneys.
Yes, that's why we donate kidney. A fat person can give a slim person kidney and all that. So they have...
Somehow, maybe a lot of us have been thinking too much, thinking that maybe this should be able to happen. Maybe we think too much.
You know, if your weight exceeds, that's why sometimes when people begin to add weight, you begin to feel some knee cramps. Because it's as if the weight that is on the bones are becoming more than it should carry. So that happens for other organs too. So these days, and most times, another thing is that when you add so much weight, you know, like it's I want to see how to give it in a layman's understanding.
Okay, please do.
When you add so much weight, you understand that there's a rise also in most cases, but not all cases. There may be a rise in your cholesterol levels, and these cholesterol levels sort of block your blood vessels and increases your blood pressure. There are high blood pressure that is mainly caused by cholesterol. Really? Most times when you correct it, the pressure drops and becomes normalized. So these are the things that comes along with being overweight. So another risk factor is taking too much alcohol. I guess a lot of people don't know that taking too much alcohol could put them at risk.
I can't Now, with these risk factors that you've just mentioned, especially talking about alcohol, I don't know, people just feel like it is normal to drink. So it can also shoot up one's high blood pressure?
Well,
I mean, blood pressure, that's what I meant to say.
well, I said it depends on your life choices. The kind of life you decide to be living or what you decide to do is what will later come as a result of, the result will now be high blood pressure. It does not necessarily mean that if you drink alcohol today, your blood pressure will be high.
Okay,
It's
subsequent.
something you do over the time. You are just doing it over the time. It exposes you.
So long as it's alcohol.
Yes.
Because I'm asking these questions because I know some persons are at home now saying, I've seen people mix up herbs and they put alcohol in it and they say it's medicinal. So someone may be home right now watching us and the person may be taking those herbs that are rooted with alcohol and then they have high blood pressure and they keep drinking it. And when I say they keep drinking, this is something they do very often, more like an everyday ritual, which simply means that they are exposing themselves to even more complications.
Yeah, but for better understanding, like this alcohol we're talking about, every drug, almost every drug contains there is alcohol in almost every drug.
Okay, now, so no, wait. Are you serious about this one?
Yeah, it's true.
Every drug contains alcohol.
Most of them, because they work as preservative. So we are not saying that taking alcohol is bad, but we're saying taking too much of alcohol is bad. There are some people that at every instance, every day they want to consume alcohol in a high quantity. But the good thing is that the ones in drugs, you take drugs when you are not okay or when something is wrong with you. It's not something, and it has a very little quantity which is okay for you. You definitely need one alcohol or the other in your body to continue working. But the ones we do as normal, want to enjoy our lives, 15% alcohol.
I'm nodding my head because I'm sure some persons at home right now saying, oh, so in case you ever bragged and said, I've never tasted alcohol, you might have just tasted one.
Yeah,
your drugs.
That's the thing. So most times you have tasted alcohol, but we are saying of course, anything you do in excess becomes a problem to your health. For example, if you say, I love eating cake, when you eat it in excess, it becomes a problem to your health.
Absolutely.
You say you want to eat in proteins. I don't want carbohydrate. I don't want sugar. When you eat protein in excess, it becomes a problem to your health. So anything you do in excess becomes a problem to your health. So another risk factor is stress.
Okay.
Yeah, stress for me, is one of the leading risk factors people have, because it comes along with depression, a lot of things that has to do with emotions. And then normally stress is good for human life, but how you manage the stress becomes the major problem.
Nigerians are already stressed. So I think it's a part of our lives.
Yeah, it's a part of our lives, but we should try to manage our stress so that it will not affect our health in return. A lot of people don't even have a time to rest. Okay, look at what makes stress to affect our blood pressure. Do you know that if you're stressed, normally stress should cause a steep rise in your high blood pressure, of which we need stress to achieve our goals and all that. You are under pressure. But then if stress can cause dangerous and serious illness if you don't manage it well. And some of this stress come from emotional things. Maybe I'm depressed, I lost a loved one, that's why when you say you have BP, the first thing that comes to people's mind is, what are you thinking?
Exactly. It's the only thing people ever talk about.
People only talk about,
what are you thinking about?
And what is it? What is the problem? Why are you thinking about this thing? But truly, that's not all. It's not all about. Some people don't think and they still have high blood pressure. Some of them will say, I'm not thinking about anything and all that. But the ability to manage your stress, get some rest, when you know you need rest, try as much as possible to rest. You know, white people usually take mental health day. But
We all need
people
it.
don't do that.
I think we started advocating for that. I am actually an advocate of mental health.
So people should just take out time, let the activities be, just relax, have a relaxation time, allow your brains to rest, just give yourself that rest, recover, and then you go back to your work.
This stress that you even mentioned, some persons always say that whenever they are stressed, they gain weight.
Yeah.
Is that true?
Yeah, it's true, very true.
And now that's invariably affecting...
It's still affecting their health.
I get it.
So we should always find... I had this client of mine, so every day she would tell me, I'm having headache. Come and check my BP. Every day she will say it. And now ask her a question. Have you ever taken out time to rest? You go for night duties, her work, she can go for night duty, morning duty, afternoon duty, and she does not rest. She is a woman with kids, of course, so there is no rest for her. So one day I said, can you just... She had this little wound, very small wound. She had this very small wound. I'm not expecting that wound to disturb her. She's already on antibiotics, but she will call me, this thing is paining me. I said, go and rest. Stop stressing. You know, when she took the advice, she said she went inside her room, locked the door, didn't look for somebody to take care of the children. Do you know that wound stopped paining her? Because
just little rest.
Just
no wonder doctors will always recommend bed rest most of the time.
Yes. Like when people come now and you check their BP and it's high, what I normally do to them in most cases is to collect their phones. Because their phones will not allow them to rest.
Okay.
So when you are giving the person a bed rest, you know, seize the person's phone for like 2 hours, just go and lie down. Even if you're not sleeping, just relax. You know, when you relax, your blood vessels, your muscles, everything just... And sometimes you take a massage.
Oh.
It's a beautiful thing to take a massage, you know. Just give yourself that relaxation, because this stress is, as in Nigeria, we say, who stress help. Sometimes you will finish stressing the whole thing and then it's still the same case scenario.
Very true. Now, because you mentioned the woman that she said when headache comes, she just tells you, check my blood pressure. Let's talk about some of the signs and symptoms that that a person with a high blood pressure begins to experience to know that, I need to check my blood pressure.
Well, of course, I've mentioned headache already.
Yes.
Severe headache. In most cases, a headache that are related to blood pressure, they don't stop. They don't stop even when you take paracetamol. They are just constant. They are just constant. So it's very important to check your blood pressure if you're having headache. And sometimes, sincerely, sometimes some people don't get any symptoms at all.
That's what I heard. I was even going to ask. Well, I've heard that some persons don't even get symptoms.
Some people don't get any symptoms at all until it's becoming complicated. So the symptoms we have mostly are when it is becoming complicated. You start having difficulty in breathing, you know, chest pain, irregular heartbeats. Some people will tell you that my heart is palpitating. It's like it's beating faster than necessary, you know. But that is when it has gotten to a very critical stage. You know, like blood pressure can affect the brain. It can block some arteries in the vein, leading to stroke. So that's where you hear of case of people just moving on the road and put their head on their steering and they are gone. Some people, they just tell you they want to go and sleep, and from there, they are gone. No symptoms at all. So, but in the worst case scenario, you can find headache, like I said, severe headache, difficulty in breathing, um, irregular heartbeats, and also depression. You had depression. So these are the common, some people stroke. So it's only when it gets complicated, but the most common symptoms you see is headache.
Okay, you talked about us checking regularly. How regular should we check? And okay, let's talk about how regular we should check first of all.
Well, how regular you should check? You can check every day. These apparatus are there. You can buy, keep in your house. You can as well go to a nearby pharmacy, check your BP. Some pharmacies run it free.
Oh, some.
Yeah.
Because I think my guest sometime back said it's free of charge.
Yeah,
Wow.
some.
Okay.
Some run it free, some don't. But you can as well get the apparatus. We have digital ones. We have the one you use in your arm. We have the one you use in your wrist. They are there. Just, you can wake up in the morning and just do your vital signs, check your BP, check your sugar, check, and just be sure that you are fit to go out. You know, because sometimes symptoms doesn't show. It's something you should do as regular as possible, as often as possible. It does not really have a particular time you say, I need to go and check my BP. You can wake up in the morning and check your BP, and that's fine.
Oh. All right, so let's talk about the BP readings. What's the impact of that reading, and how can one even understand those readings?
Well, generally, I will say that the normal ranges are ranging from 140/90 to 120/80 or 110/70 is still perfect for a normal blood pressure, depending on age range. Depending on your age range. So, you know, like when I mentioned those numbers, some people may be asking, what's that number you're calling, you know?
Exactly. So we need the interpretation of those numbers.
Yeah.
I'm sure some persons are just wondering, when they go to hospital and they give them that number, maybe 1 something over 1 something. I remember while I was undergoing antenatal and all of that, they would always check and they would give me this and that. I don't even know what it was. But
Okay, so the first number is the pressure of the heart, like we call it the systolic number. It's the pressure of the heart when it contracts. So the last number is the pressure of the pressure in the blood vessel when the blood vessels are now relaxed. So those two make up the blood pressure per time. So that's why you get 120/80, 130/90, which is fine. Although when it starts becoming abnormal is when it is above 140/90.
okay,
Yeah.
abnormal is 140/90
and above.
Okay.
Like, let me not say abnormal is 140/90, but when it is more than, we don't want that diastolic to get to 100, and we don't want the systolic to get to 150. So to be in the normal range, like I said, depending on your age, you know, you cannot expect someone who is just 20 years to be having 140/90. You
okay, but
suspect
can
that.
the person be prone to it?
Yeah.
Okay.
Like, we have people who are 20 years that are overweight. At least while I was working in a facility, I have tested someone who was just 19 years, and we checked his BP that day. It was 180/110. It's just a young boy, but he had so much weight. He's basically obese. So it's possible. So when someone is within the age range of 20, 30, and you are now getting 140 over something, you'll be like, oh, maybe this person's BP is rising. Okay, but we don't use one reading to say that somebody has blood pressure. It's something we monitor in like 48 hours to be sure that it's actually blood pressure is actually high. For example, you walk into a facility, they check your BP. That does not necessarily mean that your blood pressure is high. They will have to, if it's so high, they will control. But they can't give you medications for high blood pressure until they have monitored you for like another 24 hours. Because there may be things causing it. It may be stress, it may be your cholesterol, it may be something. Maybe when the root cause of the high blood pressure is found and taken away, you'll be fine. So you may not necessarily be on the drugs. So
Wow.
that's it.
So now I'm just very curious, and I want to bring hypotension. Hypotension, that's what you called it, right?
Yes.
I want to bring that in because you said that is even deadlier. So I want to bring that in because I want you to shed light on that as well. Because some persons might be experiencing the hyper while some are experiencing the hypo.
Yeah.
I remember one of my family friend had issues, and then he said he went to the hospital and they said his blood pressure was too low. So I was curious, like, it's really high we hear of, and people want to drop it. And now is yours now too low that it's now becoming a problem. So I want you to please shed light on the hypotension as well.
Okay, hypotension is more or less like when the pressure in the blood flow is low, you know. And these things, like I always tell people, sometimes this thing works together with your sugar level.
Okay.
It's more or less like either there is an abnormality in the heart, or there is no enough glucose to, the body needs glucose generally. At least I've met someone who told me that in the morning she ate, what was that? She said she ate cabbage, no operation, no sugar. So she was living on just vegetables, no sugar. When we checked our blood pressure, it was low.
And that's risky, you said.
That's risky too. The reason why it seems dangerous is because drugs cannot be given to you. We'll only look for means to get it to come back to, normal. Because drugs at this point, it's easier to get when it is high. We'll give you something and you're good, you're fine, it comes down. But when it is low, sometimes you may not even reach the hospital.
Wow.
Yeah.
Okay.
Like I'm talking from
experience.
From experience, for myself. I'm like talking from that experience.
Okay. Well, we're going to talk more on this, but we need to go on a quick break. Please just hold on to that thought. All right, viewers, let's go on a quick break. I'm sure you're learning something today, but stick with us. We'll be right back. Welcome back, viewers. We're still looking at hypertension/hypotension with community health practitioner Happiness Moses. All right, before we went on the break, you were talking about hypotension, and you said some people may not even get to the hospital.
Yeah.
Please explain more, because I don't know what I'm understanding, but please just shed more light on it.
Like I was saying, it's a personal experience.
Yes.
During my first year in school. So then I was not even I just got into college, so I didn't really know about it. So one certain day I came back, I was vomiting. The next thing I saw myself on the floor. I could not really talk. It's just that somebody came in, rushed me to the hospital. I was literally unconscious.
Wow.
So when they checked my blood pressure, they said your blood pressure is 88/60. Thank God somebody found you on time.
Oh, 88/60 is very low?
Yeah.
Okay.
Low. So she was, thank God somebody found you on time. And it was very funny, because in a twinkle of an eye, you may not, that's why people can be walking on the road and just slump. So, earlier I said it works together with your sugar.
Yes, you did.
So in most cases, those people, if you interview them very well, you notice that they have not even eaten all through the day. Most of those people that you see them walking on the road and they slump, some of them, they had not eaten. Some of them, they will tell you they are on dieting. A lot of different things. Or they have taken some drugs that will actually lower their blood pressure, or some diets or food they have eaten that also, on a normals, their blood pressure is on the lower side. So when they now take those things, it further brings it down. and I'm putting them at risk. You understand? So a lot of people don't know about this hypertension, but I call it, for me, I feel like it kills faster than even high blood pressure. Because heart attack, the heart can't stop pumping. There's no pressure. Because it's pressure that helps it to spread, you know. And then when the pressure is low, that means the blood is no longer getting to all aspects of your body. The pressure at which is flowing to get to all parts of your organs is low. So these are the things, these are the risk factors of it. And the risk factors also is just that maybe, you know, those with low blood pressure, we ask them to take alcohol too.
Yeah.
Just as something to keep them.
You tell them to take alcohol. Oh my God. Okay.
They take caffeine. That's why a lot of them take Coke. They don't play with
stimulants.
Yeah, just something that stimulates them, do exercise and all that, you know.
But okay, so for this hypotension now, what are the symptoms that they begin to experience?
Dizziness.
Because it's, dizziness.
Yes. Though even high blood pressure also have dizziness as one of its symptoms. When your blood pressure is high, you can also be dizzy. But when your blood pressure is low, the dizziness we talk about is something that makes you, it's like you're weak from inside. It's like you cannot draw strength from anywhere. You're like, inside of you, you are feeling like empty and weak. Those kind of weakness, you need to see a medical personnel as fast as possible. It's not something to ignore.
Maybe at that point, we should begin to talk about first aids in that case, because I realized that a lot of deaths have happened because people have no knowledge of first aid. I think I saw a viral video of a lady that got into a fight with her roommates, and she
bled to death.
Yes, the knife caught her, and then she started bleeding. And even though someone had been recording before all of that scene, but they still didn't do what needed to be done. I don't know if she eventually died, but I know she collapsed.
Yeah,
so I don't know if she
said
eventually died.
She died.
So I realized that people have little to zero knowledge about first aid, especially things to do in this kind of situation. Now, because you discussed hypertension as one of the deadliest cardiovascular diseases, let's look at what people can do
at home
when they begin at home, first of all, because it is important to have that first aid knowledge of what to do. Else, you said they may never get to the hospital. So before you go to that hospital, what should you do for that person that is extremely weak? If you discover that that is the symptom that the person is experiencing, they tell you, I'm very weak, I'm dizzy, what should they do?
Okay, if you're weak and you don't have any challenge with sugar challenge or something, you should move and take drinks. Soft drinks like Coke are available because it serves as a stimulant. I said it works hand in hand with your sugar level. So in most cases, when your sugar level is very low, there's every tendency that your blood pressure will be low. So you take something like drink. That's basically the only thing you can do at home because you don't have the drugs to give. You don't have the IV lines to set. Sure. That's basically what you can do. And to get the person to a nearest health facility so that they can carry out the right first aid. That's basically what you can do. The drinks are the basic things. That's why I said it's fast to kill, because in hyper you can quickly get their drugs over the counter and tell them to take. But in hypo you can't, because you can't buy drugs for them to take. Maybe the drugs you buy will even lower it more.
Wow.
Yeah, so that's why you just get them drinks, and as well, that's why that's the importance of getting those machines in your house. Buy them. They are there. Once you buy them, they will teach you how to use it. Wake up in the morning, check your blood pressure, so that you know, is it time for, because they don't show symptoms until it has gotten so low. You won't get to see any symptoms. Nothing will be wrong with you. All of a sudden, you're feeling dizzy. All of a sudden, you're feeling dizzy. And okay, there was this case scenario. A sales rep, I worked in a pharmacy before now, so a sales rep came to supply drugs. So when we saw her, when she came, we're like, we called her name. She was not responding. She was with us, but she was not responding. We didn't know that she was feeling dizzy and weak, and she was unable to even talk.
It can get that bad.
Yeah, we didn't know. We were just like, what's wrong with this one? She does not want to respond to anybody today. You know, we never knew until she got to her car, and immediately she got to her car, she just slumped there. So the only thing she did when she got to that car was to try and hit the horn. When she hit the horn, so we went out, we saw her lying down there, you know. The only thing we could do was to get water, you know, pour her, give her Coke. And when we gave her Coke, she was a bit revived before we rushed her to the hospital.
Thank God you knew what to do.
Thank God we knew what to do. So some people can, from there, they just go. And those deaths could have been avoided, but because there was no help, and then also people don't check themselves. People are so careless about their health. Checking your BP and your sugar is something you should do. Even if you don't have the machine, at least once in a week, you should. It should be a normal routine. Those are vital signs. Because if anything happens to the heart or your sugar level drops so low, it can affect almost all your organs. For example, your sugar level is very low. It affects everything because your body needs sugar to run everything. So your brain needs sugar to think, your heart needs sugar to pump, everything in your body needs it. So it's a vital, that's why in the hospital we call it vital signs. We are taking vital signs, your temperature, your heart rate, your heartbeat, your blood pressure, they all fall in your vital signs. They are vital. Once you are okay with them, any other thing is a walkover.
Okay, so what about the hypertension now? Does it have any first aid treatment?
Yeah. When you go to a nearby pharmacy, they can give you a first aid, at least to bring it down. For example, now somebody walks into the pharmacy and then we check the BP and it's quite high, maybe 180, 170. That is, do you know some people, like those that don't have symptoms, what would they do at that point? Because most of them, it can just lead to stroke. You can just hear that they fell and become stroke. You can't do anything at home. They say it's village people. So, you know, for that one now, you can't do anything as a layman. You just need to take the person to the hospital and then they'll do what they can do. Of course, that one is reversible. So where we are having challenges in the hypertension is reversible, but not easily reversible.
Because of the risk.
Yes, because of the risks of it. But for hyper, they can go to a nearby. And one good thing about hyper is that the drugs are very much affordable.
Okay.
Yeah, you can just have 1,000 and you get drugs to take. They are very much affordable.
Even now that everything has skyrocketed.
Yeah. Okay. Even now, the drugs are so affordable. So, and then another thing I would like to talk about is that a lot of people feel like, so will I continue taking drugs for BP? Why will I continue taking drugs for BP? I keep educating them that there is already a challenge in the heart that this blood pressure has caused. So taking the drugs is not necessarily just because you want to lower your blood pressure, but it's because it's correcting that particular thing that is abnormal, that is making that blood pressure to be high.
Okay.
So, and for you to stop the drugs, it has to be with the help of your medical personnel, taking it out gradually. Because when you add drugs, the heart is used to the drugs working together with it. And when you pull it out, it can just skyrocket again, or rather go high again than you even expected.
Oh.
And a lot of people make that mistake.
Maybe because people don't want to live on drugs forever. And it's always almost as though people who treat high blood pressure stay on constant drugs for years, months.
Yeah, and the beauty of it is that it doesn't have effect. It doesn't have any side effect. You just wake up and take one pill of drugs. I feel like it is better than the complication that comes with it.
Very true. Maybe some persons will still hang it on faith, like I've prayed and I'm fine and I can stay away from
I
drugs.
actually have such kind of people around me that believes that, they said, I won't take the drugs. Okay, you won't take the drugs, but after a few days, the blood pressure is back. It's now high. So which do you choose to take? Just
Or not to take.
or not to take, you know?
Or just a religious society. Now let's also look at it from this angle. Let's talk about some of the things that people get to experience and the misconceptions that people have about high blood pressure. I don't know the ones that, because I'm sure most persons have come to you and they've said a lot of things. So from your experience, I want you to share some of the misconceptions that you've heard of. But I'm going to share this with you first and have you share yours, because I've heard some people say when you consume lots of salt, you're prone to have high blood pressure. How true is that?
Yeah, it's very true. The body doesn't need so much sodium. Salt is sodium. So the body doesn't need so much sodium. You know, the little quantity of salt we use is okay for our body. Do you know that even when you don't put salt to taste a food, like you want to, the way you want to feel it in your mouth, so long as you add a little of salt, it's very much okay for you.
Oh,
yeah,
okay.
If you can be able to train your tongue to taste, for you to feel okay with that, it's very good. So I think I skipped that. I skipped to mention the risk factor that too much of salt is actually one of the risk factors.
I think I worked on myself several years ago and I stopped using salt. The only thing I do with salt is to probably to just wash my vegetables, wash my meat and all of that.
Yeah, if possible, one should do that. But not just salt. Taking things that contains sodium is more or less like taking salt.
Okay.
So apart from the salt we use in cooking, what about the ones we drink? We should take notice of those things. You know, we mostly concentrate only on the cooking salt. But what about the ones we drink, the drugs we take, like someone who is already diagnosed, like you have high blood pressure, should not take any drugs that has sodium in it.
Oh, now this is it, and this is where a lot of pharmacists probably need to come in, because most times people just walk into the pharmacy and say, I want to buy these drugs, and they don't even ask questions. What are you using these drugs for? What is your medical history? And I feel like maybe people need to always work with prescriptions, and we love self-medication a lot, and that's what puts us in problems, health problems.
Yeah, we love self-medication, but the pharmacists are there to guide you. In most cases, we ask people to tell the doctor or the nurse or the pharmacy or a medical personnel, whatever case it may be, let them know your history.
That's if some people are willing to.
Yeah, because some people, like, you know, last time we were talking about ulcer, you know, I said we needed to ask some people, you just have to ask them, do you have this? And
some people live in denial. They'll tell you no, and some will tell you, if I tell this person what is my health history, they'll give me too many drugs because they want me to just patronize them. That's the first.
Yeah, but that's a wrong notion. Some of these drugs cannot be, how do I call it? They cannot be used together. And some of these drugs, if you have a particular condition, there are some drugs you shouldn't take. So we have to like navigate and get drugs you can take even with that condition, so that it will not aggravate the condition that is already there for the present one. So these are what people don't really understand, this concept. So it makes them reserved. When people are coming to buy pain medicine or something, you see them walking and say, give me medicine for pain. They don't want to know whether, you be like, if you even ask them sometimes, is your blood pressure okay?
They feel like you're invading their privacy.
Waiting be that one now. You know, they will feel somehow. So I feel like it's also left for them to say, abeg, I get BPO. Don't give me something that is not related to this, because people don't know. They are not aware. But also the medical personnel should also ask them. Ask them. You know, it's very important to ask them. When I worked in the clinic, I remember this case scenario. I can't forget that case scenario. So the man came into he came to take his injection for that day. So when the nurse asked him, did you eat? He said, now you won't give me food. Why are you asking me? I have eaten. You know,
Okay.
the way he answered her, she was like, please, sir, let me know. Have you eaten? Say, I've eaten. Now why are you asking me? Come and give me my injection. Let me be going. Sincerely, that man was giving that injection. He collapsed.
That means he had not eaten.
So when they finally resuscitated him, eventually that man had not eaten. Or rather, what he did was to take pap, akara, and beans. And immediately he finished eating, he started coming to take injection for food that has not even digested or circulated. The body has not received the nutrients, just still in the stomach. So it's as good as somebody who has not eaten.
Oh my. I've never thought of that. That when you eat and it has not even digested or circulated,
Yeah,
you shouldn't even take injections.
No, I personally, I don't agree to it that you just finish eating. I said, I've eaten. Just come and give me injection. I can be able to take it. I can't dare it. On a personal note, I can't dare it. I can't, because for me, the food has not gotten to your body, has not absorbed it. For food like beans, like proteinous food, they take longer time to digest, and you just take it. And even carbohydrate takes time to digest, has a process, you understand? So like, give it an hour and come, so that by then you would have, at least your body would have taken some of the nutrients, glucose would have multiplied, and then you have strength.
Wow. This is new, because normally I know people just say, so long as you've eaten, it's fine. But what about people who have faster metabolism?
Yeah, it's fine, but they cannot have fast metabolism that will just be immediately.
That's true.
Definitely must take some minutes, 30 minutes or so. And so people will just ask them to, if it seems necessary that they must take the injection at that time, we ask them to top up with drinks like Lucozade, all those things, which is direct.
Okay.
The glucose has already been metabolized, like they don't need to pass through another digestion from the mouth and all that to just get into the stomach and absorb.
Oh.
Yeah.
So let's talk about preventive measures for both hypertension and hypotension, so that viewers at home get themselves properly, educated.
So, just like we mentioned the cause, the risk factors, from the risk factors, we'll say that you should engage in exercise. Most times when you're not engaged in anything, your blood pressure tends to rise too. Like, we advise you to rest, but that does not necessarily mean that you will not be doing anything.
Okay.
Man is naturally wired to, work. So it gives you a life, a satisfaction. Generally our society will say an idle man is a devil's workshop. So it gives you the opportunity to make meaning out of your life.
Absolutely.
Which has reduced some emotional stress and all that. So get exercise. Exercise is good for living, keeps you healthy, corrects a lot of things in your body, a lot of things. Something that even, exercise can correct even things you need surgery for sometimes.
Wow.
Exercise can just help you do that when you make it a lifestyle. I was reading one of someone write-up concerning a simple exercise. It talked about correcting a lot of many bone malfunctions in the body. And it was a very simple kind of exercise. And even me, I was surprised. As a health person, I was surprised when he said it. So
discoveries every day.
that day when I tried that exercise, I felt it from my leg to my body. I could feel the sensation it was doing to my body. you know, that confirm what that person wrote concerning. So exercise is generally good for anybody with either hypo or hypertension. You should always get exercises. Now, for someone who has hypotension, you have to increase your salt intake.
Okay.
But for someone who has hypertension, that's high blood pressure, you should reduce your salt intake. So again, when you know that it is genetic, then you have to take deliberate steps not to make those life choices that brought about the genes.
Oh.
You know, genes has to do with life choices, habits, things that have become a part of you. So you now being around maybe tendencies that your father or your far distance father or grandfather had these issues, and you grew within that vicinity, you should now start taking action steps. For example, reduce your salt, do your exercises, you know, have time to check yourself or regularly as possible. You know, start avoiding those things they were doing, those lifestyle they were doing that brought about the genes. So you now have to deliberately start working on yourself. So that is one of the ways to prevent yourself from high blood pressure. It's totally preventable. Of course, stress management. Depression. Depression is very, very bad.
I heard that insomnia too can cause high blood pressure.
Do you know that insomnia is one of the symptoms of high blood pressure?
Oh.
Yeah, it has a lot of symptoms. We just mentioned a few for the sake of this. But when somebody starts, you're not sleeping, definitely your blood pressure will rise. Absolutely. Because you need rest. That sleep is therapeutic. Sleep is therapeutic for everyone. It just kind of relaxes your brain. So when your brains are not relaxed, your blood vessels are not relaxed.
Maybe deep sleep, because some people are sleeping, but their minds are very
They are
far.
very, yeah. So you need a deep sleep. A deep kind of sleep is also a form of, then you should be able to manage your stress. Of course, take life easy. Is one after the other. Life is generally one after the other. You can't achieve everything at the same time. Sure. If you fail, you rise and all that. So stress management is very important.
All right, let's get your final words to our viewers so that they know that hypertension is not a death sentence. It is treatable. Your last words to them.
Yeah, hypertension is not a death sentence. You know, drugs for you to control your blood pressure are there and are very, very affordable. And I would like to encourage you that even if you're taking BP drugs, as the case may be, or rather hypertensive drugs, it does not necessarily affect your day-to-day life. All you need to do is to eat healthy and then keep taking your drugs. Doesn't change anything about you. You're just doing your best to keep yourself fit. And you can actually live with this for years without having a complication for heart attack and all that. You can just be yourself, take your drugs, and you're good. Also, for those with hypertension, get yourself regularly checked. I would advise that anyone with hypertension should have these BP machines in their houses so that you can always monitor your blood pressure, as this may not come with a symptom. And always have regular checkups too. This is not a death sentence so long as you take notes and you're careful about your health.
Thank you so much. We really appreciate you for your time today.
Thank you, ma.
You've literally said it all, and we really appreciate you. Thank you so much.
Thank you. God bless you.
All right, viewers, that's Nurse Happiness Moses, a community health practitioner, and you've heard so much already from her. There's nothing more from me. And that's how we draw the curtains on today's show. I am Olamide Al-Hassan. We'll see you again next week. Bye for now.